my name is student Dr. St. Louis, and how would you like to be referred to?
Callie.
Okay, nice to meet you, Callie.
Nice to meet you.
So, Callie, what brings you in today?
My right foot is itchy and it's sweaty and it has an odor.
Okay, so when did you start noticing the itchiness?
2 weeks ago.
Can you point to me where in the foot you feel it the most?
In the middle here.
Okay, and would you say the itchiness is like persistent throughout the day? Is it on and off?
It's on and off.
Okay, is there anything that you do to alleviate the itchiness?
I use cream
What about anything that aggravates it?
every time I run.
Okay, and do you feel like it moves anywhere else on your foot?
Yes, to my toes.
Okay, and how would you rate the itchiness on a scale of 1 to 10?
7.
Okay, so now I'm gonna move on to your past medical history. Have you had any recent hospital visits?
No.
Okay, do you have any illnesses as a child?
No.
What about illnesses as an adult?
No.
Are you on any medication? Do you have any allergies? Okay, have you had any recent blood transfusion?
No.
And your emotional state seems aware and alert. So now I'm gonna move on to your social history, okay?
Okay.
So do you smoke at all? Like
No.
cigars, cigarettes, no?
No.
How was your sleep? How was
It's sleep good.
okay, and do you practice safe and monogamous sex?
Yes.
Okay. What do you do for work?
I'm a student.
Do you exercise?
Yes, I run track.
Okay. Do you do any recreational drugs?
No.
Okay. Do you have any pets?
No.
Have you traveled recently?
No.
And do you drink?
No.
Okay, so now I want to move on. Oh, I want to ask you really quickly about your family history.
Okay.
Do your parents have any like illnesses like diabetes, hypertension?
No.
Okay, what about your grandparents? Any diabetes, hypertension? No. Okay, so now I want to move on to your physical examination.
Okay.
So the first thing I want to check is going to be the vascular portion. I'm going to check your pulses here. Okay, 2 out of 4 to dorsalis pedis. I'm gonna try here. Okay, 2 out of 4 palpable for the posterior tibialis, bilateral. I'm also gonna check your pulse down here in your popliteal region. 2 out of 4. I'll try over here as well. It's 2 out of 4. It's palpable. All right, so now I'm gonna check your capillary refill time. Okay, it's less than 3 seconds on the right foot. It's less than 3 seconds on the left foot, so it's good bilateral. I do see hair, which indicates that it is that there's good circulation, warm to cool. Let me also just check the skin turgor. That seems normal. I don't see any edema. Don't see any varicose veins. Everything looks good. So now I'm gonna look at the derm. Okay. And when I see your skin, I don't see any lesions. I don't see any markings or anything like that. Everything looks fine. Check underneath as well. Good, I don't see any bruisings, no ulcers, no scars. I'm gonna check your nails. Do your nails look normal? So it's normotrophic. Normotrophic bilateral. I don't see any discoloration. I do notice that there is a bunion bilateral on the hallux. There is a little bit of dryness I'm noticing here on this side as well as on this side. On the plantar aspect, I don't see any calluses, no hyperkeratosis, no wounds, no ulcers. Bilateral, excellent. All right, so now I'm gonna check in between your toes here to check for maceration. I do see a little bit of maceration on the 4th interstitial space. And same thing here. Okay, so now I want to move on to the musculoskeletal portion. Okay, so I'm going to start off by just kind of checking your range of motion in your ankle joint. Okay, perfect. It's normal range of motion for your ankle joint. Bilateral. I'm now going to check your subtalar joint. Normal range of motion. Bilateral. For the mid-tarsal region, it's normal range of motion bilateral. First ray, normal range of motion, bilateral. All right, now I'm gonna check for the the cervicales test. Okay, there might be some equinus here on the right foot. Okay, left foot is normal, so positive for the right foot. Now what I wanna do is I wanna just check for your muscle strength. So I'm gonna have you scoot up just a little bit towards the end. I'm gonna push down and you're gonna push up against me, okay?
Okay.
Excellent, 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 excellent. All right, 5 out of 5 for the muscle strength test. Okay, so now what I want to do is move on to the neurological portion, okay? I'm going to first start off with the sharp and dull test.
Okay.
So I'm going to prick you with this. I know it looks sharp, but it's not that bad.
Okay.
This is sharp, and this is what the dull feels like. Your eyes are going to be closed, okay? Right?
Sharp.
Okay, good.
Dull.
Okay.
Sharp.
Uh-huh.
Dull.
Good.
Sharp.
Okay.
Dull.
Excellent.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
All right.
Sharp.
Okay.
Dull.
All right, excellent. So it's going to be 5 out of 5 for the sharp and dull test. I'm now going to move on to the monofilament exam.
Okay.
And again, it looks sharp, but it's not.
Okay.
Your eyes are going to be closed, and every single time you feel it, you're just going to say yes. Okay?
Yes.
Okay?
Yes.
Good.
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 Yes.
All right, excellent. 10 out of 10 for the monofilament. I'm now gonna do the vibration test. This is what it feels like when it's vibrating and when it stops, okay?
Okay.
Yes when it's vibrating, no when it stops.
Okay. Yes. No. Yes. No. Yes. No.
Excellent.
Yes. No. Yes. No. Yes. No.
All right, so I would say 5 out of 5 for the vibration test. I'm now gonna do the reflex test. So I'm just gonna tap your knees with this. Okay. Okay. All right, so it's normal for the patella reflex. I'm also gonna do the Bensky test. So I'm just gonna do this. Cross your feet. Excellent. All right. Excellent. So the Bensky test is normal. All right. So after doing your physical exam, I'm starting to believe that what we are experiencing, or what you're experiencing, is athlete's feet. The dryness from constantly running or sweating a lot. Also, I do see from the masturbation as well. Also could be from a lot of sweating as well. So what I would recommend for the dryness that are on the inside of your feet is to put Lotrimin. It's an over-the-counter cream, and that should help with the dryness, and it should also help with the itchiness. You're gonna apply like once a day, or anytime you after you take a shower, you could just apply it on there. For the masturbation, you're just gonna use an ointment called the Whitfield ointment, and just apply it onto that space. Again, like every single time you shower, you just wanna kind of go through with that, and that's gonna dry it out. Okay. I also want to do a quick little biopsy of both the flakes here and the masturbation, just to confirm that it is fungal. It could also be bacterial.
Okay.
And so once we have the results, we'll have a definite confirmation of it, okay?
Okay.
I want to see you in 2 weeks.
Okay.
All right, thank you.
You're welcome.
All right.